Shame-attacking exercises are a technique used in rational emotive behavior therapy, REBT. The goal of these exercises is to help individuals confront and challenge their irrational beliefs that cause shame, guilt, or embarrassment. Here are some examples of shame-attacking exercises. 1. Put a dog collar on a banana and walk it on a sidewalk. 2. Stand in an elevator and face a back corner rather than the elevator door. 3. Ask a stranger what year it is. 4. Walk down the sidewalk singing at the top of your lungs. 5. Film yourself in a busy park making faces. 6. Dance while looking for a book in a library or bookstore. The following are guidelines a psychotherapist typically gives a client in how to conduct a shame attack without resulting in negative consequences. 1. Non-hostile and non-aggressive. The exercises should not be hostile or aggressive. They should not frighten or harm others. 2. Self-focused. The point of the exercises is to focus on the self and not poke fun at others. The intended goal is to challenge one's own dysfunctional or irrational beliefs that cause shame, guilt, or embarrassment and in no way is intended to embarrass or make fun of others. 3. Respect for others. It's important to respect other people's boundaries and not involve them in the exercise without their consent. For example, asking someone if you can lick their ice cream might be seen as an invasion of their personal space. 4. Legal boundaries. The exercises should not involve any illegal activities. It's crucial to respect all laws and regulations during the exercise. This includes public decency laws, trespassing laws, and others. If there's any doubt about the legality of an exercise, it's best to consult with the therapist or even legal counsel. 5. Occupational considerations. The exercises should not jeopardize the client's job or professional reputation. For example, performing a shame attack exercise at the workplace might not be appropriate, especially if it disrupts the work environment or violates workplace policies. It's important to consider the potential professional implications and perhaps choose settings for these exercises that are outside of the workplace. 6. Guidance of a professional. These exercises should always be conducted under the guidance of a trained professional. The therapist can provide valuable insight and ensure that the exercises are done safely and effectively. They can also help the client process their feelings after the exercise and use the experience to foster growth and learning. 7. Cultural sensitivity. It's important to be aware of cultural norms and sensitivities. What might be considered harmless in one culture could be offensive in another. 8. Physical safety. The client's physical safety should always be a priority. Any exercise that could potentially lead to physical harm should be avoided. 9. Emotional safety. While the goal of these exercises is to induce feelings of embarrassment or shame, they should not be so intense as to cause significant distress or emotional harm. 10. Confidentiality. The client should be reassured that their participation in these exercises is confidential and will not be disclosed without their consent. These exercises are designed to be harmless but embarrassing, helping individuals to realize that they can survive the discomfort of embarrassment and that the opinions of others do not define their self-worth. It's important to note that these exercises should be conducted under the guidance of a trained professional. Remember, the goal of these exercises is not to cause distress, but to help individuals confront and challenge their irrational beliefs about shame and embarrassment. It's always important to have open communication with the therapist and to voice any concerns or discomforts that may arise during these exercises. The therapist can then adjust the exercises accordingly to ensure they are beneficial and safe for the client. This video is intended to educate, but in no way is intended to offer legal, medical, or psychological advice or treatment. If you believe you need help, contact a relevant professional, such as a lawyer, physician, or licensed mental health professional.